Good afternoon, everyone. Welcome back. For those of you that were with us 5 minutes ago, I apologize for the little glitch there. This is CATAnetTV, the mobile health channel. I'm David Farnes, the mobile health lead with the Canadian Advanced Technology Alliance. Joining me today is Matthew Johnson, who is the Senior Business Development Manager with the Ontario Centres of Excellence. And Matthew's here to explain to us a new program, Advancing Health, that OCE just recently launched. I think it's a very exciting program. I think it will fill a niche for innovators, entrepreneurs in Ontario who are developing e-health and mobile health solutions to address our aging population, to help us manage chronic disease and a host of other issues that we're faced with in the healthcare sector in Ontario. Matthew's here to explain to us a new program. Matthew, welcome. Thank you for joining.
All right. Thanks, David, and thanks to CATA for hosting me today. I'm happy to be able to reach out to a bunch of new companies and new people and let them know about this program. David is absolutely right. It is exciting. I think it really will fill a need in terms of facilitating the adoption of innovative products and services into the healthcare system in Ontario. And we're going to go through some of the rationale and some of the program details with this presentation today. So thank you all for joining us. So as David mentioned, my name's Matthew Johnson. I am the program lead for Advancing Health, as well as the Senior Business Development Manager with the Ontario Centres of Excellence. So Dave, if we could go to slide 1, please.
And do you see them, Matt?
I can see the intro slide. If we could advance.
Okay.
Great, thank you.
You're welcome.
So first off, a little bit of the background and rationale behind this program. So it's really born out of a realization that the demand on our healthcare system is increasing substantially, as David mentioned, with an aging population, and there are certainly no signs of this increase declining. And it's understood that technology represents a significant opportunity to improve our healthcare service and be able to manage this increasing demand with impacts to patient health outcomes, user experience, and that means patients and physicians and all other stakeholders, as well as a reduction in cost. And so it's also recognized, though, that there are barriers and challenges in the existing system and procurement methodologies and whatnot that can get in the way of the adoption of new products, new innovative products and technologies and services by the public healthcare system. And with this program, we hope to be able to overcome some of these barriers through close collaboration between the technology industry, public healthcare institutions, academia, and other stakeholders. So next slide, please. So at a high level, the program objectives are to help enable the public healthcare sector to accelerate adoption of new technologies and process improvements, and to closely engage with the public healthcare community to help them to demonstrate these new products and services, with the targeted outcomes being better patient care and health outcomes, safety, again, user experience, and cost reduction. And finally, through these demonstration projects, we hope to identify and understand how to overcome some of the barriers that exist so that we might realize sustainable and long-term adoption of innovation in the public healthcare sector. Next slide. So just a quick overview. This is some of the details of the program at a glance. It will support collaborative demonstration projects between Ontario-based industry, academia, hospitals, and public healthcare organizations. With this program, we are targeting technologies which are market and demonstration ready. That is, they have been clinically validated. They have proceeded through any required regulatory approvals. So they are ultimately products that are saleable in Ontario. And so with each With each grant, we can provide up to $250,000 with a one-to-one matching requirement on the part of the project partners. And that match can be made up of a minimum of 25% cash and 75% in kind. In addition to the base $250 grant, there is an extra $100,000 in the form of two $50,000 academic vouchers that can go towards bringing academic collaborators on board the project to assist with the project activities. With this program, we expect to make 10 project investments over 2 years, and so this is year 1 of the program. We may fund up to 5 projects. It's possible we could do more if there are just excellent projects to be able to turn them away. And finally, it'll be a 2-stage application process, beginning first with an expression of interest, and that form is available for download from our website. And upon review of those EOIs, we'll be inviting those excellent project proposals to submit full proposals. Next slide, please. So how it works, and part of OCE's role in this initiative is to help to facilitate connections between Ontario-based hospitals and public healthcare institutions and the companies in order to pilot early market engagement and demonstrate these new innovative technologies where they are very closely aligned with a discrete need in the healthcare system, and that's very important. This is very much positioned as a pull program. So the problems should be broadly recognized throughout the system and by the partner, the public healthcare partners on the project. And so in support of this matchmaking, we will hold partnering forums, and the first one was held yesterday in Toronto. And this year's call is based on the theme of ICT and mobile applications designed to address challenges in acute care, community care, and/or mental health. So these are the clinical focus areas for the technology demonstration. There will be another call next spring, and the theme for that call has not been resolved, but you can count on this process repeating itself next year. Next slide, please. And so, as I said, there is up to $250,000 available from OCE for each project, and we expect to fund 10 projects throughout the entire 2-year program. The one-to-one matching requirement should be made up of cash and in-kind with a minimum of 25% cash. And these funds will go to support the direct costs of the demonstration project. Those costs can be incurred by the public health care partner, by the industry partner, and by other partners on the project. So we will disperse these funds in a reimbursement model. So each partner will invoice OCE for reimbursement of their costs in support of the activities and deliverables of the project. Some of the eligible costs include salaries, consumables, travel, some equipment and hardware, as well as costs associated with external service providers. And as I mentioned,
Matthew, John Reed here. Just a question of clarification. The reimbursement, if you have a partner outside of the province of Ontario, is that included in part of the expense model, or do you have to be within the province in terms of these collaborations?
Well, so certainly the eligible partners, the core partners in each demonstration project, should be an Ontario-based company or technology vendor and an Ontario-based public health care organization. Those will be the 2 core partners. Now, if there are partners on the project, as you suggest, outside of province, frankly, we hadn't considered that. But I suppose if they are essential to the project activities and deliverables, we would figure out a way to reimburse their costs. If they may be made an external service provider, for example, and the funds may flow through the company or through the hospital, for example.
Okay, thank you. And I should remind the viewers that we'll be sending these presentation slides after the video is done, so everyone will get all this material.
Great. Thanks, John. So if we could return to the slides, David. Thanks. And so finally, again, the academic vouchers are also available as an add-on to the base project funding, and this no additional leverage is required to access these funds to bring in academic researchers and students to help with the project. Next slide, please. So the timelines associated with the process, the current call for expressions of interest is open. Again, the form is available from the OCE website, and we could probably make that template available with the slides.
Absolutely.
Our first partnering forum was held yesterday in Toronto, and we had a fantastic turnout. There's certainly been wonderful uptake and engagement with all manner of stakeholders in these around this initiative. The deadline for submission of EOIs is August 25th. There will be a review of those EOIs and requests for full proposals put out September 30th. Full proposals due in early 2015, and NOAs in and around February of 2015. So for those of you planning or thinking about projects, you could expect these projects to begin officially next spring. Next
Matthew,
slide.
is there some sort of a judging panel? I mean, some of these technologies are pretty esoteric, so I'm wondering, how is the evaluation done? Are you drawing on community experts internally, a mixture of both?
Sure. So we have an internal. We're going to assemble what we call an internal panel, and this is made up of folks from OCE, as well as an advisory committee that is helping us in guiding our planning of the initiative. So there's folks there from community care access centers, from CAHO. There are medical technology experts in that group. That's what we'll call our internal panel for now. And then when it comes time to review the full proposals, we will engage with that same panel and then supplement it with additional external reviewers based on the content of the applications that we'll have for review. So we always try to bring in the right expertise to review our applications.
Excellent.
Thanks. So if I could have the next slide, please. Okay, so a bit about the decision-making process. As I mentioned, there will be a review of EOIs by an internal panel. I guess, John, your question was timely. And based on that review, those very strong EOIs will be invited to submit full proposals. And those full proposals will be completed via an online application portal. The EOI process is purely it's a Word doc, it's a Microsoft Word template, so easy to share, easy to access. And I should mention that we don't have a specific target in terms of the number of EOIs which we'll invite. So as many excellent EOIs as we receive, I imagine we'll invite as many full proposals. And in the full proposal assessment, again, we'll supplement our internal panel with additional expertise. Ultimately, the funding decision rests with OCE. Next slide. And so some of the program eligibility, we'll need to have the company based in Ontario, and this could include multinationals with an Ontario operation that includes some manner of technology development. If it's simply sales and marketing or distribution, that is likely not eligible. But certainly companies of any size or stage, so long as the technology, again, is market ready. On the demonstration site side, we'll be looking for public healthcare organizations, again, based in Ontario. In aggregate, the partners must meet the minimum cash and in-kind matching requirements of a total of 1-to-1 with a minimum of 25% cash. And the proposed project must be targeted at a problem that falls under the general theme of the program that I described earlier, that is ICT and mobile applications addressing challenges in acute care, community care, or mental health. And also we will be judging the projects on the experience and potential for close collaboration. We're really looking for a high level of collaboration and engagement between the partners throughout the process. As well, the technology should be such that it is scalable and exhibit a high potential for adoption. Next. And so the evaluation criteria are as I've described. We will assess the proposed solution with respect to the problem, the project plan, the plans for collaboration, the potential for adoption and scalability of the technology, and then finally the potential impact both to the healthcare system as well as to the company in terms of economic development, job creation, revenues, and whatnot. Should the technology ultimately scale throughout the system or even to a global market opportunity. Next slide. And finally, and this is a very unique opportunity, I think. As part of each of the funded demonstration projects, the partners will work closely with OCE and an independent academic group to create a portfolio of case studies based on the funded projects. And so this academic group will help to define and measure certain performance metrics and collect all the data and be able to assemble the story of the project into a case study that will have influence on policy and be used as a tool to help guide revision of procurement methodologies and ultimately result in, or that we hope that it can help to inform a sustainable model for adoption of innovation by the healthcare system in Ontario. So this is a great opportunity for the companies to have their technologies highlighted by this independent group and be referred to through all of the future discussions around innovation adoption.
Well, you know, Matthew, that's quite critical because in essence you're sharing best innovation practices. So for future people developing technologies, they may be able to learn of an efficiency or of a particular approach that has worked well. So going forward, it helps build further infrastructure. And certainly CATA, we're very into video interviews, and we'd be quite interested in talking to some of these CEOs and having them share some of their insights on what it's like to build a business, to grow a business. So I share with you an exclamation point on the importance of those case studies. That's
you know, you've hit it right on the head, John. It's it's almost one of the most valuable outcomes of these projects in our view, even beyond the direct impact of the adoption of the technology in the system during the project. It's what we can all learn from each of those projects in helping to create an environment in Ontario to see others follow that same lead. So really a critical initiative, and we're hoping to get really innovative projects to choose from. Thanks. And I think that's the end of the slide deck. I think the last slide would have had some contact information for myself and my colleague Jennifer, who is the program manager. So it had our emails and phone numbers if anyone wanted to connect with us further. We are certainly available and happy to discuss the program with anyone who's interested. So with that, I'll end and take questions if there are any.
Well, thanks, Matt. That's fantastic. I'll throw up the contact information there, and we'll make that available at the end of the at the end of the session, and when we package this up and put it up on the social network. So
Great.
that was absolutely fantastic. Like, I've been at this with CATA and the Mobile Health Advisory Board since the fall of last year, and I got to say, the discussion of this program that you just presented really hits a lot of the key areas that we've identified, especially like the last point that you were really making around case studies.
Mm-hmm.
I mean, I think there's a lot of innovation out there in Canada in the health sector. I think we're not adopting it at maybe the rate we need to. And I think, the lack of case studies, the lack of metrics is really one of the top issues that we've identified. The advisory board at CATA has asked us to highlight something, every 2 weeks, highlight a new innovation, ideally with some metrics. So this is really going to help accumulate some of that information. And we're going to launch next week in a beta form what I like to call a book of living case studies, where we try to compile all of that information and bring it together. So that's fantastic, and I love the fact that this is a poll program. Maybe just talk about maybe where that came from, that idea of pulling this together as a poll program to drive adoption.
Right. Well, so the initiative begins at the provincial level, and with the mandate for broad review of procurement methodologies and how they might be updated and revised to better accommodate the adoption of innovation. I mean, it's understood that in particular in healthcare, the public cost of healthcare is far and away the largest of any of our public expenses, and we just it's understood at all levels that we just need a way to be able to try new things to see if we can address some of the challenges. And the great thing about the case studies of these projects is they will have very high visibility to all stakeholders that have been involved in the design of this initiative, both within OCE and other stakeholder groups in the healthcare system and at the provincial government level. So this is really an all-hands-on-deck kind of initiative, and I've observed since I've been assigned to this program similar initiatives at the federal level. So we might be reaching some kind of critical mass where we can really begin to put our money where our mouth is in the adoption of innovation.
I agree with you, Matt, and to see this scale would be wonderful. I want to congratulate you and the folks at OCE for putting this program together. I want to thank you.
Much.
You're welcome. I want to thank you for joining us on CATAnetTV, and we'll sign off now. Again, I'm David Farnes, the Mobile Health Lead with the Canadian Advanced Technology Alliance. You've been watching CATAnetTV, the Mobile Health channel. Thank you for joining us.